This is Mrs. Reichelt, and we are continuing our discussion on the skeletal system. So we're moving into the axial skeleton. So remember, there are two major subdivisions of the skeleton. You have the axial skeleton and then the appendicular skeleton. So the axial skeleton is made up of the skull, the vertebrae, and then the bony thorax. And then the appendicular skeleton is going to be everything else. So the axial skeleton forms the longitudinal axis of the body, and it's divided into three parts. You have the skull, the vertebrae, the bony thorax, and the bony thorax is going to include the sternum, the ribs, and the thoracic vertebrae. Okay, so if we look at our little diagram here, you have everything that's in this kind of greenish-y color. All of that's going to be the axial skeleton, and then everything else is made up of the appendicular skeleton. So the skull is comprised of two sets of bones. You have the cranial bones, and then you have the facial bones. Bones are joined together by structures called sutures. Sutures are interlocking, immovable joints. Sutures are sort of like stitches. They make it so things can't move away from each other, which is good news. You don't want your frontal bones separating from your parietal bones. So let's go ahead and talk about each of these two sets of bones. So there are 8 cranial bones. So there's 8 cranial bones. 2 of them are paired. So it seems like there's just 6 of them, but 2 of them are paired. Those bones are the frontal bone, the parietal bone, and that's a paired bone. So there's 2 of those. The temporal bone, and there's 2 of those as well. Okay. Then we have the occipital bone. We have the sphenoid, and the ethmoid bone. Okay, let's make sure 3, 6, 7, 8, perfect. Okay, and then the facial bones, there's actually 14 facial bones. So I'll say 8 here, 14 of those. Okay, we'll talk about these a little bit later. I don't think you have to memorize all of these ones. I would make sure you know the cranial bones. But the facial bones are going to be things like the zygomatic bone, the vomer, the mandible, the lacrimal bone, some of those that we'll go through a little bit later. And then the last little thing that we need to talk about here is the mandible is the only freely movable joint in your skull. So the mandible is the only freely movable joint, and from there all of the others then are going to be made up of sutures. Okay, so here are our diagrams. There are several of these. I recommend, if you're a fantastic artist, go ahead and draw this out. If not, you have diagrams of these in your study guide, so just fill out your notes on your study guide. So really, I have all of these written out for me, so I'm not going to do too much writing. So we first have the coronal suture. The coronal suture is going to be what's connecting the frontal bone to the parietal bone. Okay, so that's that interlocking, immovable joint. Okay, so then we have the parietal bone. The parietal bone is a paired bone. So there's 2 of those. And the parietal bone, it's not shown right up here, but the parietal bone is paired, so there's 1 on each side, and it's going to have a suture that connects each of the parietal bones, and that suture is called the sagittal suture. Okay, then we have the temporal bone, and the temporal bone is inferior to the parietal bone. Then we have, let's see, the occipital bone. I'm going to go back up to these. So the occipital bone is going to be right back here. It's that brown bone right there. Okay, the lambdoid suture connects what? You tell me. So if it's right here, what's it connecting? It is going to connect the parietal to the Occipital. Good. Okay, so then we have the squamous suture, and that's going to be right here. So what's that one going to connect? The parietal to the temporal. Good. Okay, let's see. So we're going to skip, I guess, down all the way to the zygomatic bone. Okay, so the zygomatic process is this part of the temporal bone right there, and the zygomatic process is the bridge that joins the cheekbone. So the zygomatic process is the bridge of the temporal bone that joins to the cheekbone. Okay, then we have the external acoustic meatus, and that's going to be right here. The external acoustic meatus is the canal that leads to the middle ear and to the eardrum. Okay, the mastoid process is right here. So this is that the most inferior part there is the mastoid process. And I'm actually going to erase all of this, so if you're not done writing these down, go ahead and pause them for a second. Okay, I need a little bit more room here. Okay, so the mastoid process provides as an attachment point for some neck muscles. Okay, so muscles are going to attach to bone, and the mastoid process is an attachment point. Similar to the mastoid process, we have the styloid process. The styloid process is this sharp needle-like structure, and this is also going to provide an attachment point for other neck muscles as well. Okay, then let's move up here to the frontal bone. Okay, the frontal bone is this yellow bone right here, and hopefully that's pretty obvious. It's going to make up your forehead. Then we have the sphenoid bone. The sphenoid bone is in the shape of a butterfly. As we look at some other pictures, it'll look a little bit more like a butterfly, but it really is butterfly shaped. And the sphenoid bone also makes up the floor of the cranial cavity. And again, that'll make a little bit more sense once we look at some different diagrams. Then we have the ethmoid bone. The ethmoid bone is going to form the roof of the nasal cavity. Then you have the lacrimal bone. The lacrimal bone are these little yellow, they're little green bones, and they're going to be right where your lacrimal gland is. So when you cry, you have your lacrimal bone right there. So what are we going to write here? Let's go ahead and write, it makes up part of your bony orbit of your eye. Okay, lacrimal is your tear area, so when you cry, likely the tears are going to fall down where your lacrimal bone is. Then we have the nasal bone. I think that's pretty obvious, so we're just going to move on from there. Then the zygomatic bone is this tealish color bone, and that's going to be your cheekbone. Then you have the maxilla, which is right here. Then we have the mandible here in red. And then you have your mental foramen. You have your these little margins. See, I'm going to erase this actually. Whoops. Oh, I'm getting ahead of myself here. Okay. So if we look right here, you see where there's these little notches and these little grooves where your teeth are going to be inside of your bone. All of those are going to be those margins where your teeth go. And then your mandible is this red area. And we're going to, by the way, I put in a blank diagram. So if you wanted to stop, pause the video, and see if you can quiz yourself through this, I think that would be a really great idea. But we're going to go ahead and move on. Okay, so next up here, we have some more. I'm not going to go through all of these. Make sure you're familiar with the ones that we're talking about specifically. So the hard palate is made up of the maxilla and then the palatine bone. We have the zygomatic bone that's right here. The temporal bone is going to be anything that's in orange, but then there's a bunch of different bone markings within the temporal bone. So we have the mandibular fossa, the styloid process, the mastoid process. You need to be able to identify some of these bone markings depending on the different views. So if you're at a lateral view or an inferior view, or you have to be able to identify them from different views. So then we have the parietal bone, which you can barely see here. Then you have this bone, which is the occipital bone. The foramen magnum, okay, is right here. The foramen magnum is going to allow for the spinal cord to connect with brain. So connects to the brain. Okay, the occipital condyle, these are sort of, they look kind of like rockers. Okay, so these occipital condyles rest on the first vertebrae. So those rest on the first vertebrae. Then you have the jugular foramen. This is going to be the passage of for the jugular vein. Then you have the carotid canal, which allows for the carotid artery to pass through. Then we're going to go ahead and talk about the sphenoid bone, the greater wings of the sphenoid bone. So it's kind of starting to maybe look like a butterfly. You have wings kind of right over here. And then once we get a different view, it'll look even more like a butterfly. And I better not forget the vomer, which is right there. Okay, and again, there's a blank picture. Go ahead and quiz yourself. Pause the video and quiz yourself before you move on. Okay, so now we have a different little view. Hopefully this one now, if you're looking at this pink bone, which you should now know as the sphenoid bone, hopefully you see kind of how it looks like a butterfly now. Kind of look, it has wings, it has this middle area that looks like the middle of the butterfly. If not, we'll talk about those specifically in a couple minutes here. Okay, so we have the frontal bone here, and then we have the ethmoid bone. The ethmoid bone is made up of this cribriform plate, okay? Then from there, the cribriform plate, actually, before we move on, I better write it over here. The cribriform plate is actually going to have a bunch of little holes for olfaction or for smell. Okay, and then we have the crista galli. Okay, the crista galli is that line that's right there. Okay, that is called the, sometimes people call it the coxcomb, because the brain coverings attach right there. Then we have the optic canal. Okay, the optic canal is where the optic nerve passes and goes to the eye. The sella turcica, what bone is this? Sphenoid. Okay, the sella turcica is sometimes called the Turk saddle. I better write that also. And then this is going to be where the pituitary gland sits. So the pituitary gland is right there. And then the foramen ovule is where some of the cranial nerves, cranial nerve 5, you don't need to know that for now. Then we have the temporal bone again, the internal acoustic meatus, the parietal bone, and again, these are now review. And then there's another blank one, so go ahead and quiz yourself. Okay, so our last diagram, I think this is the last one. Okay, so you have the frontal bone here, we have the parietal bones, we have the temporal, we have the sphenoid, we have lacrimal, these little green ones. I think I called them yellow last time. We have the nasal bone, we have the maxilla, the mandible. Go ahead and quiz yourself on these. They're also labeled in your textbook, so go ahead and try to memorize as many of those as you can. And there are the answers for you as well. Paranasal sinuses allow for, they're the hollow portions of the bones that surround the nasal cavity. There are many functions to the paranasal sinuses. Those include, they're hollow, okay? The functions include they lighten the skull, and then they give resonance and amplification to voice. So you're probably most familiar with your sinuses when they cause you problems in the spring or in the fall. But you have sinuses, they lighten the skull, and they're going to give resonance and amplification. Then we have the hyoid bone. The hyoid bone is the only bone that does not articulate with another bone. That is a great test question. It's just the definition of the hyoid bone. So go ahead and make sure you write that down. It also serves as the movable base for the tongue. And then it aids in swallowing and speech, and it's just where this diagram is. And there's a couple of pictures, or we have a couple of hyoid bones in class that we'll be passing around as well. Okay, and our last section for the skull today. So the fetal skull. The fetal skull is really large compared to the infant's total body length. That's what makes babies so cute, right? They have these structures called fontanelles. These fontanelles are the fibrous membranes that connect the cranial bones. Okay, so this allows for the bones to grow. And then those fontanelles are going to convert to bone. So convert to bone after 24 months. Whoops, I'm not 24 moths, but 24 months. Or 2 years. Okay, so that wraps up the skull, and I hope that helps you with the axial skeleton.